The alarming rise in COVID cases in our country. Yesterday, the United States reported a record-breaking 1.8 million positive cases, although officials caution some of that's from a holiday testing backlog. This comes as Chicago Public Schools announced in-person classes would be canceled today after the teachers' union there voted to switch to virtual learning only, and it seems they call the tune. For more, joining us now is board-certified emergency medical physician and Abe's News contributor, Dr. Darien Sutton. Thanks for being here, Dr. Sutton.
Thank you.
And let me ask you, good afternoon. As I just mentioned there, Chicago Public Schools now no longer holding in-person classes. It's the teachers basically who made the call there. The news announced in a tweet after 73% of the teachers voted in favor of remote work only. Thinking about the amount of resources we have and what this does to the health of children. Is this really necessary at this point in the pandemic? What do you think?
Yeah, when I listen to these arguments, I understand both sides of these arguments. On one hand, schools are a necessary form of not only academic instruction, but also social education, and for many, a form of housing and nutrition. But we have seen that although this virus is less commonly causing severe outcomes in pediatric age groups, those under the age of 18, the risk is not zero, as children are susceptible to not only infection, but also transmitting it to somebody within their home who may be more vulnerable. But we have seen that the schools that had practiced mitigation efforts, such as vaccination, masking, distancing, as best as they can, have limited to no outbreaks compared to other schools who don't.
Well, I want to go now to the mayor of Chicago. It was my hometown, so I've got patriotism there. But Lori Lightfoot, Mayor Lori Lightfoot, spoke about the decision. She expressed her frustration. You can hear it. Let's see what she had to say.
It feels like Groundhog Day, that we are here again at this hour, almost 8 p.m., after everything that we've gone through over the last 2 years with the CTU leadership. Unfortunately, tonight, CTU leadership is compelling its membership to make a decision that will harm hundreds of thousands of Chicago families who rely upon CPS for their daily needs, for their education, for their nutrition, for their safety.
Well, Doctor, that's what you were talking about, what school does beyond just the reading, writing, arithmetic, and Mayor Lightfoot there referring to CTU, the Chicago Teachers Union. It does seem that that stakeholder in a lot of places has the greatest weight. How should these decisions be made from a public policy standpoint? I don't want you to take a side here, but
yeah, of course.
What's the best approach, do you think?
You know, while I obviously can't answer the question regarding the political side of this question, I can answer what it's like to try to help someone who is in acute distress, who is panicking, and unfortunately, they just simply need answers. You know, when I'm looking at situations like this and those handled by the mayor, you know, when I see the situation as a physician, I'm answering the question of what can we do to create a plan? We know that we are in need of not only testing, but also vaccinations. If you look at the population across the United States, those aged 5 to 11, only approximately 16% are fully vaccinated. And then when you look at those aged to 12 to 17, only approximately 54%. So we do need more participation in vaccination. And then there are additional questions that teachers are likely asking. Am I protected? Are there masks that are available or appropriately fitting? Do we have high filtration N95 masks available? Is there testing available? It's still an issue in many parts of the world and the country, obviously. And we're seeing people line up for hours to get a PCR test, and that's unacceptable. I think until we have appropriate answers to those questions, will we come to some type of meeting of the minds between the teachers union and those that govern Chicago.
That's a great point, that the factors that are pressing on all the stakeholders here, they need to be addressed to get the emotions calmed down. Let's turn to the boosters. You mentioned the younger cohort. Boosters for 12 to 15-year-olds now, we are hearing, could be available as early as this Thursday. How critical is that going to be for schools, do you think?
You know, I think it's going to be a helpful assistance to preventing infection, as we have seen in early data that boosters not only help to decrease the risk of hospitalization and death, but also overall infection. But after the decision is likely to be made today regarding availability of boosters to these age groups, we'll have to wait, right, for people to schedule appointments and for those shots to get into those patients' arms. But I do want to say that there's something that's really important that I hope this doesn't distract from, which is from the benefit of the primary vaccine series. We still need need more and more younger adults and young children to participate in these vaccines in order to decrease the risk of transmission overall. And like I just said, we still haven't gotten to an appropriate, acceptable amount. So I hope that this is helpful, and I hope that this goes forward, but I also hope that it does not distract from the benefit of those first shots.
People should definitely get their shots. So according to the American Academy of Pediatrics, new COVID cases, and you were talking about this as well, in children, increased nearly 64% over the last week. So what are we to make of that case count? How serious is it? Because is it the vast majority of kids will be okay? And what is it about Omicron that's different?
I think it comes down to the fact that the Omicron variant is simply more transmissible. And unfortunately, this pandemic is doing what it does, which is targeting those who are vulnerable, including the elderly, the immune compromised, and of course, the unvaccinated, as those who are under the age of 5 don't have accessibility to the vaccine yet because we're still waiting on those studies. And like I said, those over the age of 5 have not fully participated in terms of vaccine participation and getting those shots that we need them to get. I think when we look at the rates of hospitalizations, it's important to understand that I think it's more of a combination of the fact that more are getting infected, and we have not yet seen any signs that this variant is proving more harmful to to children in general. But it's important to understand that vaccines provide benefit even to younger populations on an individual standpoint. If you look at New York City and you look at those who are hospitalized over the age of 5 and eligible for a vaccine, almost 100% of those between 5 and 11 are unvaccinated. Those are the patients who are admitted to the hospital. And then older than that, we're still seeing approximately 75% of those patients are only partially at best vaccinated. So it really homes down on the point, which is that vaccines are beneficial not just for the elderly and the immune compromised, but all of the general public.
We can all be protected with those vaccines. Billions of shots have now been given, and they're safe. There's no question. Dr. Darien Sutton, thanks very much as always.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.